problem that you have is what they call insulin sensitivity or insulin resistance. Now, you know, type 2 diabetes actually is a condition that you can reverse. It is reversible, you can treat it, you can cure it. And what you need to do, you should be eating to beat diabetes. Not eating to live with diabetes, but eating to beat diabetes. Now, diabetes is simply an impairment in the carbohydrate, fat, protein metabolism due to one, insufficient or lack of insulin secretion by the pancreas, or due to insulin resistance. Now, the two things that I've said that would bring about an impairment in the metabolism of carbohydrates, of proteins and fats are: one, it is the insulin insensitivity or insulin insufficiency. So when dealing with diabetes, this is diabetes type 2. That's what we are handling today. So if you are dealing with diabetes and they tell you you've got diabetes type 1, mostly what is happening is that your cells, your pancreatic cells, they are unable to secrete the sufficient amount of insulin. They might be secreting a bit, but sometimes actually they might not be secreting any at all due to various reasons. It could be due to genetics, it could be due to infections, it could be due to trauma, a lot of things that can bring about that. But when talking about diabetes type 2, what is happening is that you have insulin insensitivity. Your body is made up of cells. So from your head to your toes, you've got cells, a number of cells, a lot of them. So you've got cells. So you've got cells that all over your body, and then you've got cells that make the liver. They call them hepatocytes. And then you also have got cells that form your muscles. Then you've got cells that form your adipose tissue. Okay. So now what happens is, whenever you eat a meal, that meal that you are eating, it is going to cause a rise in your glucose, blood glucose level. If you have not eaten anything early in the morning, when you've not taken anything, your blood glucose level is around 80 to 90 milligrams per deciliter. If you are using millimole per liter, you'll find that it's somewhere around 4 to 5 millimole per liter. That's if you've not eaten anything. That is in the morning, or maybe when you've not just taken anything. Let's leave it there, when you've not taken anything. So what will happen is, when you eat, the way God has made our body in that it tries by all means to maintain a stable internal environment. Meaning the various processes that work in the body, they are trying by all means to make sure that they keep what is happening in the body constantly. So when it comes to blood sugar, it has to be at a constant level in the blood. Too much of it will cause problems. Too less of it will also cause problems. So now, if you eat something, let's say you eat a carbohydrate meal, your blood sugar is going to go high, and it will need to come down. And when it comes down, sometimes it might come down too low. But then you get to know, you get to realize that if the blood sugar is gone high, what will bring it down? There is a hormone that is secreted by a certain organ in the body. There is an organ in the body that is known as a pancreas. So this organ has got an endocrine portion. It does quite a number of activities. It controls quite a number of processes. It has got what is known as the exocrine and the endocrine portions. And the exocrine portion, you'll find it secretes certain substances or chemicals that help in our digestion and other things. The endocrine portion, it is a portion that secretes some chemical messengers that will be transported through the blood, and they will have to go and work on a target organ that is called, those are called hormones. So some of the hormones that are secreted by the pancreas are what are known as, there is insulin, and also there is a hormone called glucagon. So insulin is secreted. These pancreas have got a portion that is known as isolate cells or isolates of Langerhans. These are a group of cells just within this pancreas that have got also groups of cells that produce certain hormones. So these isolates of Langerhans, these isolate cells, they are what are known as the beta cells. The beta cells are the ones that are going to produce this hormone, insulin. They are also what are known as the alpha cells. The alpha cells are the ones that are going to produce this hormone, glucagon. Now, the beta cells produce insulin when this blood that has got an increased amount of glucose after taking a meal reaches the pancreas. The pancreas will sense and will know that the blood glucose has gone beyond. It needs to be brought down because too much of it is going to destroy other tissues or is going to cause so many problems in the body. So when that blood reaches the pancreas is going to secrete insulin. Now, secretion of insulin, there is a video that is on a channel, a YouTube channel known as Physiology, made easy for medical missionaries, where you are going to find how insulin is secreted and how glucose is secreted. So the pancreas is going to secrete insulin. This insulin is going to come. When it is coming in blood, it's going to go to various tissues of the body or various cells, and it's going to tell the peripheral cells to open so that the glucose that is in the blood, the excess glucose that is in the blood, should enter into these cells. So the insulin here is acting as a key to come and unlock the cells, because these cells actually, they cannot open on their own for glucose to go in. So insulin has to come like a key to unlock these cells and tell the glucose to go inside. And once the glucose has gone inside, the level of glucose in the blood begins to go back to a normal stage, a normal level. Now, some of the glucose, after the glucose has gone into these cells are going to use this glucose to form ATP, which is like a currency or a fuel for energy, so that your body has energy. So that glucose is going to be converted into ATP and later converted into energy. Okay? So now, after these cells have gotten the amount of glucose they need, the excess glucose is going to be pushed into the liver for storage in form of a molecule called glycogen. So, when the liver gets a certain amount, or when the liver has gotten an amount, the other form of glucose, the remaining excess of glucose, is also going to be pushed into the muscles. And what is causing the liver cells to open so that glucose goes in here, it is also what? Insulin. So it has worked on the peripheral cells. What the excess that remains is going to be pushed to the liver.